Hey, greetings everyone. Dr. Melanie Crites-Bachert here with 360 Pelvic Health Institute and the Center for Men's and Women's Urology here in Portland, Oregon. Coming to you today with a new segment, and I want to address a very popular treatment that we have for bladder dysfunction. And a lot of patients have never heard of it. Some patients have, but it's very, very common and something that we use quite often in urology. It's called a suprapubic tube. Now, what is a suprapubic tube? It's basically a catheter that goes into your bladder, except instead of going down below through the urethra, it's actually placed just above the pubic bone in the abdomen and goes directly down to the bladder. It is actually a regular catheter. It's just that it goes in a little different place. Now, why would we use a suprapubic tube? Well, sometimes patients have a little difficulty emptying their bladder and they don't get it completely emptied because maybe they, if you're a male, have a strictured urethra, which means a narrowing in the urethra, making it difficult for you to get urine out. Maybe you have a very enlarged prostate. Perhaps also if you're a female, you've had a neurological condition such as multiple sclerosis, or you've had a stroke, whether male or female, you've had a stroke or some neurological insult that causes your bladder to not function properly anymore, and you have continued urinary leakage, but you also don't get the bladder completely emptied. We have to have a way to get that urine out, and lots of times a tube going in through the urethra is not always comfortable. So we put the suprapubic tube in through the abdomen. It's much more comfortable. It's much easier to care for. There are a variety of ways that you can care for it, and it's individualized to each person. You can either wear it attached to a drainage bag so that it drains urine continuously, or you can put a plug in the end of it and wind it up, put it underneath your clothing, and go to the toilet every 2 or 3 hours, take the cap off, and empty your bladder through the tube. So for females, basically what I like to tell my females is it instantly turns you into a male. It gives you the ability to go out and go to the toilet without actually having to sit down on the toilet. Some ladies prefer that, and hopefully it helps to lighten the mood for them a little bit. We often use that in conjunction with Botox injection into the bladder because the Botox is a treatment for bladder overactivity. So it stops those bladder spasms, it stops the urinary leakage. And lots of times that suprapubic tube not only allows us to get the bladder completely emptied, but it also allows a doctor to inject Botox into the bladder to stop that urinary leakage, and the patient is dry, which, if you've been wet chronically, that's a very welcomed thing to have dry pants. We can also use a suprapubic tube if we need to irrigate the bladder out with for recurrent urinary tract infections. So a suprapubic tube isn't a bad thing. It's a very wonderful option for the properly selected patients. If you're wheelchair bound, if you have decreased mobility and you're having difficulties getting the bladder emptied, talk to your doctor. This may be the right thing for you. So, hope this helps everyone. You can go to the website. We've got much more information and pictures of the suprapubic tubes and how they go in. Of course, we always have email, so send us a question. I'd love to answer your questions. Hope you got something out of this, everyone. Take care. Have a great day.